Today, I'm doing an interview with Dr. Arun Kumar. He is the principal of Saveetha College of Occupational Therapy in Tamil Nadu, and he has an experience of about 18 years in this field. He is an executive member of All India Occupational Therapists Association. Thank you, sir, for joining us for this interview. And yeah, hope to learn a lot from you. Yeah, so I had come across a column written by you in what is it? Newswhos.com. Yeah, you were talking about uh, what makes occupational therapy critical for people with disability. Can you just share something on that?
Yeah, occupational therapy is a very important profession to support help person with a disability. Person with a disability, occupational therapy working not only in exact particular part, physically or mentally, those who are have difficulty or disability, they need occupational therapy services to improve comprehensively in their quality of life. So occupational therapy is very important to improve their fine motor, gross motor, and also higher cortical functions and make independent in daily activities uh, without depending on others. As much as possible, the person make independently. It is the main aim of the occupational therapy.
Okay, okay. So the next questions. How can an occupational therapist impact the life of a person with disability?
Yeah, a person who have a difficulty or a disability or doing any inconvenience in daily activities. The daily activities means caring about the own self and work and also the communication and interaction with the environment. So it is a meaningful for the person who have the normal scenario. So person who have any injury or disability, this leads to some impact or some drawbacks to interact with you others and doing the daily routines. So the occupational therapy is working on the all the aspect core comprehensively in the person with the disability and as much as possible giving the supportive devices and therapy interventions so make him into independent into daily activities not only in the particular affected area or affected part and due to this the person may have to improving the all the aspect and due to the occupational therapy intervention the person able to do care about his own self and the work and the communication to the social and they have to give the productive input to the society. So in the overall aspect, they working in the person fine motor, grass motor, higher cortical function, social skill, emotional, and physical aspect as well as the mental aspect also. To doing to activity to improving their ability during the from the disability to the making the ability person in the society. So in the aspect, the therapy is a major key role to the improving and making independent in the person with the disability.
Okay, okay. So, our center is a multidisciplinary center where an occupational therapist, speech therapist, and a special educator, they work together. So, what is your view on multidisciplinary approach?
Multidisciplinary approach is very, very evidence based and very uh, important for the person with special needs or a person with a disability because one professional is not enough or not completed to improving the quality life of the person with the disability. For example, for person who have physical disability need a physiotherapy intervention, psychological intervention, occupational therapy intervention, physical medicine intervention, all the nursing intervention, other things. And all. So the particular professionals they work on the particular part. Is a comprehensive, is a mixing of the skills. We need the all the expertise, professionals, knowledge, professionals intervention for the person to improving their disability. So in the aspect, multidisciplinary is a very important
Mm.
to do in the improving the person also changing the life or improving their quality of life means definitely the multidisciplinary is very important.
Okay. Okay. So, can you share your best approach to motivating parents?
Best approach is uh, the parents they need to more awareness about the particular condition about that child. If the child come across any difficulties or any their diagnosis or any disorder, they know about the get the clear evidence based clinical information from the professional. Then based on the professional advice, they go for the interventions treatment plan. And according to the to work, it's a combination of the effort from parents, children, and the professionals. They get the qualified, eligible professionals' ideas. So the awareness, and also they have to get the what are the advanced and the adequate, reasonable, and evidence-based treatment for the particular conditions.
So, what do you value more? Yeah, you are a principal of Saveetha College of Occupational Therapy, right? And you're an
Yes.
yeah. So, what do you value more, being an occupational therapist or being a principal?
Actually, it's like uh, basically I am an occupational therapist. Through occupational therapy only, I became a principal. And more as two is very important part because okay, as occupational therapy uh, it is my professional. I teach, advocate, and I will give treatment and I will improve the quality life of the person with the disability. And in the administration part or teaching part, the principal position is very important. Through my principal position, I teach my or pouring my knowledge to in my student or what are the my aim to the benefit of my professional to the person with the disability to improving the quality of life, they're reducing the disability and improving their ability. As a therapist and principal as a post is very important and is two is are very equal respectful manner. As an occupational therapist, I am doing the treatment and I'm doing assessment and I am improving the quality life of those who are client come for their difficulty and I am using my knowledge and I am improving my services. At the same part, as a principal, I spreading my knowledge to my student. The student that they go and wherever they go and they are helping the person with the needy people, especially the disabled population. Through my knowledge is spreading to the overall the globe and the person who have exactly getting the benefit of needy people. So as a principal aspect, it's very important to pouring the knowledge. We can't treat one person all the disability, but we can extend our knowledge, sharing our knowledge that indirectly helpful for the needy people. So
Yeah,
occupational therapies is very important. Principles of course also very important.
yeah,
So it's like a two eye for the human being.
yeah. Okay. Yeah. So, what is the best part about being a principal of a college?
Yeah, actually the Savita Occupational Therapy College is started 1998 and 8 years they are run very successfully and eight batches are came out and they are working many places and they are giving services and some the dropping of the admission is happened 2008 and last from 2008 to 2017 9 years there is no admission in the college and the college is closed and 2017 we approached the the management is started restarted the college. So started restarted the college is a best uh, my in my career. It's a very I think is a big achievement to own college to restart the again, and now the batches are completed. They are working in many places, and we started MOT courses and PhD courses in occupational therapy. So the restarting the college 2017 August is a just a memorable thing. And the person who are studied and they are now are working in many places. They are passed out. When they pass and they get a convocation, POT convocation. That momentum is also very memorable thing
Yeah.
in my career in push therapy.
Okay. Okay. Yeah. So, what advice can you give young occupational therapists or students who have chosen the field?
Occupational therapy is a noble professional. Is a services as well as is a professional. So young occupational therapy need commitment, knowledge, and dedication, hard work. So
Hmm.
they need a commitment. Of, whatever thing situation, whatever that is not matter. They do the on time dedicated services to the client and accept the full knowledge to the improving the quality of life of the person with the disability
Hmm.
and the knowledge. They continually updating the knowledge, research based knowledge. Then only
Hmm.
they can incorporate to the improving the person with ability
Yeah.
and dedication, hard work. They need a continued hard work because they are disability is the need a continue follow, continue treatment, and we can't suddenly or immediately we can expect the result. They need a continued hard work. Then only we can get the even you can see the 5% or 0.% of the improvement for the client or the adult or whatever it may be. It's important
Hmm.
because we are working on the movement,
Yeah.
activity. So person who have at least raising the hand and touching the spoon, it's a big issue for paralyzed person. So we need a hard work, continue with the consistent hard work. So
Hmm.
commitment, knowledge, hard work. It's a three core for the needed for the young people. That is
Yeah.
my suggestion, not advice, but my suggestion.
Yes. Okay, sir. Yes, that were the questions. Yeah, thank you for doing this for us. Yeah, and yeah, thank you for sharing your valuable insights on various topics that we discussed. I know many students and young practitioners will benefit from this. Thank you, sir.
I thank you, the organizer, and also you to neatly ask the question and you run the show very clearly. So thank you. God bless you.